My name is Jamal Abdul from Kenya. The patient here is my mother. She is 65 years old with a diagnosis of chronic kidney disease. Her problem started back in 2012. They did a routine ultrasound. They found both kidneys to be enlarged with an element of obstruction. So after some tests, a urologist over there decided that one of the kidney was non-functioning, so it was removed. So she remained with the left one. But after that, she underwent some session of dialysis, like around 2 months, came out of it. Also, the left remaining kidney was still obstructed and it was enlarged. They put a stent and removed. Now the diagnosis there was retroperitoneal fibrosis. They had given her a course of medication, tamoxifen, steroids. But she was in outside hospital. She's been admitted like 5 hospitals in Kenya, in and out. Her condition wasn't doing very well. So early this year, she had a problem. Her creatinine started rising again. They put a stent in the ureters. It improved a little bit. They removed it in September this year. But after trying to put another one, because they said it's scheduled only for 6 months, she became anuric. She could not empty her bladder. So they had to put a nephrostomy tube. After that, my brother saw your brochure, the ad that specialists from India will be coming to Nairobi. So when the doctor from Vikram saw her in Kenya, in Nairobi, he had ruled out the retroperitoneal fibrosis. He said maybe he'll need a correction of the ureter was obstructed. She'll need a pyeloplasty or something. So when we came, we did some investigation outside and saw the doctor. The doctor explained everything. At first, he had to confirm first where the problem is, do a preliminary procedure. She did it the second day on admission. He confirmed where the obstruction, but he was able to put a stent, and mother started emptying her urine through her bladder. So after like 2 days, he went in now for the major procedure. He found the ureters to be stuck on the posterior abdominal wall with some fibrous tissue. So he released, made it free, and the surgery was successful. Now afterwards, they've been monitoring her creatinine levels. It has been decreasing. She came with a creatinine of around 2.4. But as per today, this day 8 post-op, and it's around 1.7. So the function has been increasing, her output has been increasing. They took the nephrostomy tube out, the one she came with from Kenya, and now she's okay.
This is regarding a patient by name Abdul Rudugo, a 65-year-old lady who came to us from Kenya. She was a complicated case which was initially managed in Kenya, where they could remove the right kidney because it was not functioning. They preserved the left kidney initially with a tube drainage externally. When the patient settled down very well, they were able to put a stent or a tube which drains the kidney to the bladder, and she was taken out of this external drainage. Again, when she was under follow-up, they were not able to re-stent, that means put the stent from below, and once this patient again needed dialysis or machine support, she was again introduced a nephrostomy tube or external drainage tube. When they reanalyzed this patient, they found that the left kidney was functioning at around 25 ml per hour, which normally combined together should be about 120 ml. So the idea was not to lose this kidney, and since this was a difficult case where they couldn't re-stent the patient, they sent this patient to us. After she came here, we reanalyzed this patient. We found that the upper part of the tube which drains the kidney to the bladder was completely blocked. So the only option was to explore this patient. On exploring, we couldn't identify the tube, which was totally stuck to the abdominal wall, was covered with lot of fibrosis. We had to retrace it after mobilizing the kidney, and we were able to mobilize this ureter or the tube, and we were able to bring a part of intestine called omentum and wrap this omentum around this mobilized tube so that the fibrosis will not occur again. Post-operatively, patient did very well. We were able to remove the external drainage tube. The creatinine, that is the kidney function, improved from 2.3 to further 1.7. Her urine output was very good. She was able to pass urine by herself without any catheter. So she was discharged from this hospital. We expect this patient to do very well. She will continue to pass urine from below, and she will be out without any tubes in future. So we can say that we have been very successful in treating this patient.
What I can say about Vikram Hospital, it's like the facility is patient friendly. Everybody's like they know what they do, starting from the security, from the cleaners, from the nurses. And another thing, there's cross consultation, like mom has been seen by different doctors, and there's cross consultation to really know her problem. The international coordinators back from Kenya, Lucy, was very helpful. I got my passport and visa within 2 weeks, and transportation to the airport was very reliable. Here I was also picked at the time when I arrived. And inside the hospital, the coordination from Dr. Shailaja, Aisha, they've been very well, always coordinating, checking up on mother. What I've found to be very good with Vikram, it's like a home. People are friendly and everybody knows their work well. So you really feel settled and you feel at home. I will recommend, because after they made the diagnosis in Kenya, things have moved really fast. Here it's like they really want to solve your problem. It's not like a place to take you to another facility so that they can push your problem forward. They want to sort your problem here, because after the diagnosis, things have really moved fast. So I would recommend everybody from all over the world to come to Vikram.